All right. Well, welcome again, everyone, for the Health Data Commons Birds of Feather session for the GORC International Model Profiling. This is a Birds of Feather session that we're aiming towards to go to a working group, but we're going to have some discussion on what Lauren, Maxwell, and I have worked on so far in this area. And we're going to be taking turns kind of presenting different aspects of a proposed case statement and some of the work that's already happened that kind of went into the fruition of creating such a proposal. So I think one thing we missed last time that we should definitely do this morning, though, is introduce ourselves. So my name is CJ Woodford. I'm a co-chair for the GORC International Model Working Group. And I helped create the model over the last year or so. So that's where I'm coming from in this. I'm currently based in Canada, and I work for the Digital Research Alliance of Canada. And Lauren, would you like to introduce yourself?
Yeah, sure. So my name is Lauren Maxwell. I sit at Universitätsklinikum Heidelberg, which is in Heidelberg, Germany. And I work on the research response to emerging pathogens and the connection between intervention studies and observational studies with a focus on how those different groups of studies implement FAIR. And within CoData, I am a co-chair of the Sensitive Health Data Working Group, and then wanted to build on the work that CJ and the GORC work have been doing by bringing kind of GORC into the health data domain by looking at these different country-level health data comments.
All right. And so with that in mind, let's jump into it. So welcome, RDA newcomers and new members. Thank you for being at this Birds of Feather session. I think that we don't have any, I don't think we have any new members here in this very, very small call. So we're keeping it pretty informal. And maybe just a little bit of housekeeping. You know that you're being recorded. But if you have any questions, please feel free to raise your Zoom hand, and Lauren and I will pause and we'll have a discussion wherever we need to. But we do have like designated discussion times too in the agenda. Please feel free to, and I encourage you to write down your name and your contact information in the collaborative rolling notes. And I will also point out that the links to the slide and the GORC model, as well as our draft case statement, are also in that collaborative rolling notes. They're actually before you get to the session one like attendance list. They're just above that area. Okay, so let's do some icebreakers first. So there's 3 Whova polls that are you're prompted to answer when you join, and we're going to look at do your organization currently work with health data? Because that's what we're going to be talking about today. How well would you rate your organization's use of FAIR? Because we're kind of honing in on FAIR, how to help increase FAIR use in the health data space through vicariously through the profiling. And then where do you or your organization find FAIR best practices? Because that'll help us figure out making an implementation profile. Because this is not just a profile of the GORC model, it's going to be the full, I don't know, the full 3-course meal on what do you need to consider and how do you get there. So I hope that folks have filled it out. So yes, use health data, that's great. Not a surprise given the topic. How well would you consider using it? Some FAIR best practices. Okay, that's also really good. And commenting again that I wouldn't expect anyone to write here 100% FAIR because that's literally not possible currently. But that's definitely the goal that we want to aim for. Oh, whoops, click the wrong one. And then where do you currently get them? EC funded projects. Very interesting. Okay, so some of the things we've seen before here are like FAIR sharing, RDA outputs, and so on. And so we don't want to hide them, but what we'll do is we also had a poll on the previous sessions in the previous session that had these exact same questions. And I think maybe what we can do is add the results to the collaborative notes, because I think that that's a really interesting view on where people get things. And then we have a way for folks to share things even before the working group starts. So that's nice. We have more polls in here, but we're going to get to them later. So those are icebreakers. So thank you for participating in that. And so we've done our icebreakers. Great job, everybody. What we're going to do now is Lauren will introduce FAIR for Health Data Commons. I'll talk a little bit about the Global Open Research Commons International Model, or GORC. so that we're all on the same page. Then we'll talk about the case statement. And lastly, will be a little bit about the logistics for where we see the group moving forward from the work that Lauren and I have done and the discussion we have today, as well as any recommendations for additional groups that should be involved. All right, so I'll hand it over to Lauren.
Great, thanks, CJ. So we've thought about this as a working group, but we're going to consider other options for this as well. So this group, which we're calling Health Data Global Open Research Commons Implementation Model, is related to the goal of defining and supplying fair metadata to describe health data commons. And we're specifically focusing on health data commons that are evolving at the country or the transnational level, because there's quite a community already of those health data commons that are generally in the process of being built, but some already online. And we'd like to understand how those health data commons relate to each other and to data commons in other spaces. So we think that through fair metadata, we can have a good idea of the different levels of interoperability that we'd like to see across health data commons, and then between health data commons and commons in other data domains. So we could go to the next slide. So the challenge that we're really focused on here is the challenge of interoperability, and specifically interoperability of participant level data and metadata. So we're thinking about looking at semantic and syntactic interoperability of country level health data commons. And we see that as a way to detect and respond to global health challenges, including emerging infectious diseases, antimicrobial resistance, vaccine preventable illnesses, and non-communicable diseases. And what the reason that we're so interested in semantic and syntactic interoperability is that we want to work towards federated reuse of participant level data across country level health data spaces. So we see that as something that could be valuable in terms of thinking about how we can collaborate on responding to shared challenges in the health space. And then fair metadata on health data commons would tell us where we need to invest to build that semantic and syntactic interoperability and get to that vision of federated data reuse across commons. Next slide. So these are just some of kind of the key objectives that we have for this work. So again, we want to define and then work with health data commons to supply fair metadata to describe the health data commons, so we can understand how they relate to each other and to commons in other spaces. So what we see as kind of potential outcomes of this is understanding what investments we need to make to be able to put AMR data together, so antimicrobial resistance data together, to look at emerging resistance across different countries, or so in a federated data reuse type approach. We'd like to understand how human health relates to climate health or biodiversity and ecosystem health. So that's what we mean when we're thinking about how do the metadata that describe the health data commons relate to commons in other spaces. We'd be thinking about how do they relate to climate data commons, or how do they relate to biodiversity data commons. And then what types of investments do we need to make to understand how non-communicable diseases relate to environmental exposures, or to chemical exposures, or to ocean health. So we see this as kind of defining and providing this metadata as a way to understand where we need to make those investments. Next slide. So some of the key questions that we had and were interested in thinking about looking at in this working group would be what national or transnational health data commons exist or are planned, what domains and types of health data are included, what stakeholders are engaged in the development of the health data commons and how are they engaged, and then who are the relevant stakeholders, so regardless of whether or not they're engaged in the development of these health data commons, and what are their priorities for cross health data commons convergence. So thinking about first defining the metadata, collecting the metadata to describe these health data commons, and then thinking about where are the priorities for convergence. So where do we really want to lean in to ensure that we can have this federated data reuse? Next slide. So we're also interested in understanding how these health data commons have implemented FAIRs. That relates to the poll that CJ put together at the beginning. How different data types are connected. So what types of persistent identifiers are being used to connect data types within individuals, or so thinking about, how is omics data connected to clinical data, connected to research data, and then what data reuse modalities are covered by these commons. So how can the data be reused by folks who are able to access the commons? What types of data governance systems are in place to make decisions about data reuse? And then what are the processes for authentication and authorization of users of the commons? Next slide. So we're also really interested in thinking about key performance indicators and data security. So how do stakeholders define the success of the health data commons? What metrics have health data commons implemented to track their successes? And then what measures do health data commons implement to protect the security of individuals whose health data are made available through the commons? Next slide. So when we think about kind of our general approach here, and these are obviously all of this is open for comment, and the idea here is to present what we've thought about and then get feedback and refine that and think about how we can move this work forward collectively. So here, our guiding principles for this work are to identify where we are and start from there. So we're not trying to make something that's proscriptive or suggesting best practice. Rather, we'd like to see what metadata are important to the folks who'd like to understand the intersections between health data commons and then between health data commons and commons in other spaces like climate data or ecology, and then provide those fair, high quality metadata so we can understand where we should invest in terms of building interoperability across commons. But we're not trying to suggest that using this standard or using this PID is the way forward. Rather, we're trying to describe what folks are doing. And we'd like for the stakeholders who are engaged in building the commons and using the data from the commons or providing data to the commons to define the metadata, because we want obviously the end product to be useful to folks and to be used to really guide policy decisions when thinking about cross commons interoperability. And we, at this point, are really not interested in saying this is fair, this is not fair. We'd like to say that, fair is a continuum and not a binary. And we'd like to think about, ways to help folks become more fair, but not kind of point fingers or say this is not fair or this isn't how it should be done. And we're not trying to suggest that we have to, that each commons has to do things in the same way. So obviously when folks use the same tools or they implement the same standards, that does provide some gains in terms of the ability to federate over different health data commons or between health data commons and other commons in other spaces. But we don't want to suggest, one way forward. We think it's enough to provide the metadata and then to let these commons decide which way they're going to evolve and where fair convergence makes sense and where they want to really, keep their individual approach to PIDs or individual approach to standards. Next slide. So I'll let CJ take over from here. So this is an introduction to the background and where we're coming from in terms of this implementation model.
Yeah, thanks, Lauren. And so Lauren's given a really good overview of what our intent is. And so the idea as a starting point or a container for how to, give us like a little bit of guide of what are the considerations that different commons would need to have these fair implementations in place, or a container that's a starting point for creating the metadata where folks can say like, well, what do I need to consider? The Global Open Research Commons model is already out there and endorsed. And so I'm just going to run through a quick introduction of it. If you are interested, there is a GORC interest group working group session tomorrow, and those groups are already endorsed and active. So I encourage you to check those out too. But essentially what we mean when we say a Global Open Research Commons is an international or global federation or interlinking of research commons. And so research commons is a wider definition we take than some other groups do, but we're kind of considering a commons as any infrastructure that would give you a place where you can work on data, upload data, use data, and other research artifacts. And so that could include things like platforms, infrastructure as a service, software as a service, uh, any sort of research institute portal that would give you access to those research artifacts or tools and services. Computing infrastructure would also fall under this umbrella. And so the idea is that we're aiming towards a global network where these research commons can interoperate, work together, have federation of services, or at least can share research artifacts in a meaningful way. The realized idea would be that different research artifacts and the ability to use them, reuse them, analyze them for research purposes would be available to everyone, everywhere at all times with the appropriate protocols and procedures in place. And especially when we're thinking about health data commons and maybe using something like the Global Open Research Commons model, moving towards that networking or fair convergence, where you're very much thinking about the proper protocols and procedures, of course, because controlled access management is a big part of that. So within this idea, there's two groups that exist right now, which is the GORC interest group, and they're working towards a roadmap of how do we actually get towards a global open research commons. So how would you move from individual research commons at the national or regional or discipline specific level and get towards that global interconnection? And we've already seen some commons working on this, like with memorandums of understanding and different contracts. With the International Model Working Group, which was under the umbrella of the interest group, our job was really to say what is a commons, a little bit more specific and itemized. So what attributes would a commons have if they wanted to be part of a global open research commons? Because we know that a lot of different research infrastructures can qualify as commons, or they can identify as commons, which is fine. But what would you need to consider to kind of move towards this global open research commons idea? And likewise, the model wasn't prescriptive. It's not telling you what you have to do, but it's intended to be kind of like a grocery list or a recipe of things, and then you can choose what ingredients you want to add to your commons. So the idea is that the international model tells you what do you need to consider, and the roadmap in collaboration with the model tells us how are we going to get to that global open research commons idea. This was a collaborative effort over the course of about 2 years. So we had a couple of stages of landscape review that went into the model, including the FAIR principles and a lot of different FAIR implementation ideas. We heard from 12 different speakers that represented commons at different maturity levels and discipline or discipline agnostic, as well as scales. So some were regional, some were pan-national, some were national. So those were the two main feeders into the model itself. It went through several rounds of revision with our working group through plenary sessions, a workshop, 26 different meetings, in addition to the speaker series. And at the time, we had 69 members, and I'm really pleased to say that on the new RDA website, we've got something like 85 members. So that's great. Don't know where those extra like 16 people came from, but thank you for joining. And because the group's been a little inactive over the last few months while we've been recovering from the model publication in October, as well as 6 task groups. And when I say recovering, I do mean recovering. These 6 task groups, in addition to a writing group, would meet sometimes like 2 or 3 times a week. So there was a period of time where for about 8 months, people were putting in hours and hours every week into this project, in addition to me being full-time on it. So it was a lot of work in there. What we used to structure the model was based on work from the interest group. So it wasn't only a collaboration internationally of folks in the working group, but we were also basing it on the collaboration from the interest group too. So the interest group back in July had released their essential elements of a commons. And the model is kind of built inside of each one of these 9 hexagons. So the model found about 400 items that fit within these different hexagons, those 400 considerations. And this is the top level to say, what are your essential considerations? So these essential elements, the idea is that a commons would have something in each one, and the model tells you these are all the things that you might want to consider within each element, but you don't have to have all of them. Maybe only some or 1 or 2 are relevant for you. So there's a combination of human elements and technical elements in the model. Governance structures, so how are you running? Your rules of participation and access for all stakeholders, internal and external. your sustainability. And I know there's a dollar sign, but it's not just your funding, which of course is on top of everyone's mind, but it can also include things like sustainability in your community and maintaining relevance. Engagement with your stakeholders and community, and human capacity, including with internal personnel. And the linchpin here for human elements as well as technical elements, because it applies to both, is interoperability and standards. That's kind of an underlying theme throughout all the essential elements, but it also has its own space in the model because it has its own special considerations. Then, of course, you've got your technical elements, which are kind of the hard pieces that you can either touch or you can specifically interact with as a user. So your compute, storage, network, and authorization authentication infrastructure, sometimes also called ICT, and our tools and services that run on top of or through compute, our ICT infrastructure, and the research objects themselves. We also identified about 95 or 96 key performance indicators and metrics, so qualitative and quantitative measures of success, progress, and that's a big one that I think Lauren and I are really keen to see how that applies to health data commons in particular, because for health data, I can see there being a lot different and maybe more granular KPIs and metrics than what we found in general. So a very quick overview of the structure. We have entities and characteristics. The idea is that essential elements can break up into categories and subcategories, and characteristics can be broken up between attributes and features. So features are more granular. Characteristics are inherited from parent to child. So if you've got an essential element that has an attribute, and then maybe that attribute has a feature, who knows how granular it is? All different parts of the model are more or less granular. That essential element has a category, then that category inherits those characteristics, and likewise for the subcategories. It's currently in a flat spreadsheet format, and we're hoping to work with RDA Tiger more on getting a better visualization, maybe more interactive relational databases or a network graph, something like that. We've been trialing a few different options, but it's all the content's in there for now. So if you did want to go in and look at it, and many people have, including some adopters, which you can hear about in our dedicated GORC IG working group sessions, it is totally navigable as a spreadsheet, but that's kind of what it looks like now. All right, so from here, we'll move over into talking about the draft case statement for this specific working group. So the GORC model is kind of the container that we'll start with. And then the idea is that we want to develop it as specifically as a profile for Health Data Commons. So I think, Lauren, is it me or you who talks about value and deliverables and scope?
I think it was you, but I can take over too, whatever you want.
Okay.
I can't remember, to be honest.
That's all right. Maybe I'll keep talking for now because I
Okay.
think because you definitely have more relevance when it comes to talking about the subdomain. So I'll keep this part. So maybe first, before we jump into the case statement, we'll leave our next discussion piece open here. But does anyone have any questions or discussion points you'd like to raise either about the model, the GORC model, and maybe its relevance to this idea of this group? Or do you have any questions about anything that Lauren presented around the underlying questions and driving forces or driving ideas? I don't see any hands and I don't see anything in the chat. All right, perfectly clear, no questions whatsoever. Perfect. All right, so we do have it more succinctly put for value deliverables and scope in the case statement, and these are just, again, even further summaries in these slides. So the idea is that by defining and supplying fair metadata to describe health data commons, so again, not necessarily saying this is what you have to do to be fair, but simply providing what are health data commons that are currently active or building, doing, looking to do, or interested in doing when it comes to fair implementation, so that we can understand how they relate to each other, and then also in other spaces, in other research spaces. And Lauren's mentioned a few of them. And so what we really want to get out of here is the Health Data Commons or HDC profile of the GORC model. So the GORC model is discipline agnostic currently. And we want to say, okay, well, now we want to make it discipline specific. And there are going to be more granular or less granular aspects that we want to include. And maybe there's whole different items that need to go in there, and we want to identify those. And then from that profiling of the model, as well as working with Health Data Commons that are active or that are interested in working with us on this, we'd love to create a network graph that actually describe the actual or planned implementation of such a profile. So what are the fair best practices that you are using, essentially, and then having that described through the model in a network graph. If there's time, and I think with any working group that's proposed, it's always like you've got this pie in the sky deliverable 3. So our pie in the sky deliverable 3 would be thinking a little bit more about fair assessment and what that might mean using the GORC model profile. But that's very much a pie in the sky one. What we really want to get out of here is the profile itself, and then a network graph that the implementations of that profile can showcase. Okay, so that's the basic overview. But Lauren has actually done a lot of work in this area so far. And so Lauren, tell us about your scoping review.
Yep. So so our vision here, which started in CODATA and is now we're hoping to leverage kind of the RDA community as well, is to think about, okay, where are these health data commons? And so what we had thought about initially is to do a scoping review to see what we can find in the literature, and then supplement that with what's called snowball sampling. So basically go to the folks who we know are implementing country level or transnational health data commons, and ask them about the other commons that they know. So a colleague of ours, Adrian Burton, for example, did a tour of health data commons in Europe. So he's coming from ADRC in Australia and working on the health data commons there. And then he came to Europe and basically interviewed folks who are building health data commons, like the folks at Health RI, the folks at the German Swarm Learning Network, to see what types of implementation decisions they're making. And so what we'd like to do is basically, rather than having that information available to certain groups, make that information available to anyone who's building up commons. And so in our scoping review, we did a systematic search to identify health data commons. We don't think that the groups have to call themselves health data commons, rather meet kind of some basic criteria for country level or transnational health data commons. And an example of that is the European health data space. So we would consider the European health data space a commons, even though they're not, or I'd say a health data commons, even though they don't call themselves a health data commons. And there are many more examples like that. So folks, we don't have kind of agreement or kind of streamlined implementation of these terminology, but we're just going to use kind of our definition, and then it doesn't matter how different groups have to label themselves. And this scoping review is the search is something we conducted some time ago, so we at this point need to update it. But I think in the next slide, or perhaps in a couple of slides, we have kind of a list of different health data commons. So just CJ, you could go to the next slide here. So what we're interested in is thinking about what types of data are represented in these commons. Because different types of data are differently important to the folks who work with health data, or who work in the cross domain space. So for example, we could think about how our EMR or EHR data reflected in commons, how is clinical research data reflected in commons. That might vary based on whether we're talking about intervention data like randomized control trials or observational research. How is omics, whether it's human or pathogen omics data reflected in commons? What about high dimensional imaging data, sample metadata or digitized samples from virtual biobanks, and then surveillance data. And there are several other types of data that we can consider, like claims data, and other data. So what types of data are reflected in these commons? CJ, you could go to the next slide. And then, okay. So when we're thinking about our draft work plan, so this is, let's say, somewhat ambitious, and we're gonna, after this discussion of the draft work plan, also come to some kind of fundamental questions about what type of direction do we want to take with this group? Would it make sense as a working group? What other types of ways could we address kind of this challenge and what we want to do here? So when we put together our draft work plan, which again is open for comment, like the case statement is, so the idea here is to basically present the case statement to the RDA community, get feedback on it, and then refine the deliverables and the goals and the timeline. So in this timeline, and it's Jake, go to the next slide. We so the first 2 months, basically starting now, we're thinking about continuing to identify health data commons. So what we would do is update our scoping review search, and then also continue to work on snowball sampling. So talking to the folks that we know who have implemented commons to see which commons they know about or have heard about, because we're interested in really reaching the commons that are already started, and then the commons that are kind of just in development. So really in early stages of development, because we think getting priority metadata from both of those. So thinking about what they're interested to know about other commons is really what we'd like to make sure that the metadata that we have reflects. So we have developed a pitch deck that we'd like to refine, and then we would develop a questionnaire that we can share with commons to understand some basic implementation decisions, and try to further engage them in the group. We are planning to reach out to Health Data Commons individually to discuss the initiative, understand better their priorities, and then further work on the snowball sampling work. We'd like to take kind of those initial conversations with Health Data Commons and bring them into a speaker series. So this really builds on work that was done in the GORC working group, where they had a fantastic speaker series that CJ discussed, where the speakers were asked to provide information from a questionnaire to describe their work in data commons, and then they were asked to give a presentation, and there was plenty of time for discussion about kind of priorities for implementation in data commons. So we'd like to do something similar here. And then months 4 to 13, we're thinking about developing so essentially taking the GORC model that CJ already shared with you, which is currently sitting in a spreadsheet format, seeing what types of tweaks we need to make to apply that in the health data commons space. So are there any kind of attributes that are missing, or we would like to kind of refine the definition of certain attributes. And then we would like to collect metadata, so understand, what are the implementation decisions of these different health data commons, given this metadata implementation model that we've developed from the GORC implementation model. We would so work with the stakeholders to review and revise the implementation model. Then we'd like to make the implementation model fair, so make sure that the metadata are built out in RDF or JSON-LD. And then we've had already interest from folks in AMR, so antimicrobial resistance, and there's quite a lot of work globally on cancer, in terms of thinking about federated reuse of cancer data, whether that's imaging data or omics data associated with cancer, or research or EMR data. So we're interested in engaging those communities to think about actually applying the Health Data Commons implementation model of the Global Open Research Commons implementation model, so that we can see, how this works in practice for these different disease communities. Yeah, so CJ, you could go to the next slide. So just in our preliminary work, these are some of the health data commons that we've identified. And some of these are more kind of global communities. Others are actually health data commons at the transnational level or at the country level. But we've already talked about the European health data space. We have the Malaysian health data warehouse. We have the People's Research Data Commons in Australia, which has a health data component. We have HDR UK in the UK. We have Health RI in Netherlands. And we have a number that are not reflected here as well, like the Swiss Personalized Health Network, and the Nordic countries health data network. So there's quite a lot going on here already. And again, what we want to do is define and provide metadata so we can understand implementation decisions within these different initiatives. So CJ, you could go to the next slide. So what we'd like to hear from folks is, who else should be involved here? So we've thought, okay, we're interested in involving folks who are kind of from the FAIR data space. So working on FAIR metadata, working on standards implementation, specifically in the health data space. We'd like to really involve the folks who are working on health data commons. So building health data commons or making implementation decisions. And then there are many, many other stakeholders that we could try to engage here. So we're wondering, if you have any thoughts on who we should engage. Yeah, so maybe I'll just leave it at that if folks have questions on what we've talked about again so far, or if you think about kind of other stakeholders that we could usually engage in this type of work. And certainly I'll say that there are a number of kind of RDA working groups that relate to this work. So the most closely related is obviously the GORC working group, but there's also the DRAWG working group that I was a part of that is related a bit to this working group. And there's the biomedical data infrastructures working group, if I'm butchering that name, but there are a number of kind of overlapping or interest groups or working groups that we will definitely be kind of using the outputs of or trying to collaborate with. But if there are other kind of stakeholders that you feel like we're really missing here, that'd be great to know. And then maybe CJ, you can lead the discussion about, should this be a working group, or is it better posited as a task force or as a tiger project? Because I think it's a really interesting decision or discussion to have when we have some other folks here. Yeah.
Yeah. And so where we're kind of hoping this will go now is an open discussion. So please feel free to raise hands or unmute in Zoom. We're kind of asking two questions here. We're asking, well, we're almost asking three. We're saying, any ideas or other feedback that on the case statement, especially the draft work plan or the deliverables themselves that people would like to raise. Are there any other stakeholders, especially any other health data commons that we should include when we're thinking about that draft working plan? And third, which is also a poll in Whova, if you want to fill that out directly, if you don't feel comfortable having it as a discussion, would be, is this actually a working group, or should it be a task force between working groups and interest groups? Or is it maybe something that can fall under the new Tiger mini project idea, where if you weren't attending that co-located session yesterday, really interesting stuff that Tiger is doing, where there's now this option to do like small projects and mini projects. And the small projects are actually smaller than the mini projects, which is an interesting naming idea, but that's the case. So we're kind of flexible on how the work gets done and what label it has, but we are interested in how people feel. And the reason why we're thinking task forces between working groups and interest groups is because this has already come up between the GORC working group and the National Data Services Interest Group, which is looking to restart, is that instead of creating a whole new group to dedicate towards making a GORC profile specifically for national research commons, we'll actually have a task force that sits between the two groups, which will not really, it's just kind of like a new RDA entity that isn't formalized. So there's lots of different cool options, and we're just kind of interested in how people feel about what we presented, who should be involved, as well as this idea of like maybe it's not a working group, maybe it should be a working group. So whatever folks in the room today would like to start on first, we're happy to move forward with and discuss. Yeah, we've got one hand up. Bill, go ahead.
Oh, yeah. Yes, my name is Ville Tenhonen. I'm from EGR Foundation. Yeah, first of all, thank you for this initiative. This is very, very, very interesting. And I can say that it's also quite hot topic right now. One couple of comments or thoughts, actually. One stakeholder, or I don't know if it's a stakeholder, but something what we perhaps should take into account is that the EOSC Association, European Open Science Cloud Association, they are founding this kind of health data task force. It's not founded yet, but will be founded in near future, perhaps decided or opened within this month. And they have some key focus areas which are connected with the European health space, but also identifying business processes and making some mapping with the health data research projects and process models and so on. And then it's related all these fair data issues and so on. And yeah, European health data space you have already there. And then there is a different smaller group in Europe, for example, GEANT. They have a one kind of working group in this area and so on. And yeah, if there will be the working group, I'm interested in to be a member of that working group if you need. Thank you.
Great, we definitely need we definitely need people to be members. So thank you. And no, that's really good to know about the task forces and groups working on it in like within EOSC as well as GEANT. And I knew that EOSC was probably going to head in that direction with a task force or a task group, just given because there's going to be a European health data space. But it's really helpful to know what groups are out there because we can reach out to them. We can reach out to them directly and say, hey, do we want to have members in both groups so we're not duplicating work, but instead doing complementary work. Oh, Lars, go ahead.
Lars.
Thank you. Thank you for a great presentation. This is both a really needed and welcome initiative. Yeah, I think when we're looking at whether or not it's a working group or not, I think it's important to think about that what we want to achieve is a concrete and distributable output, right? And it's important that it doesn't get lost among all the other outputs. So for that reason, I was kind of considering a working group because then it's confined in that space. The idea of a task force seems very good, but it's a little bit hard to know kind of how that would impact in the form of deliverables. And I was also thinking a little bit about when it comes to other groups that we need to consider. Also, the sensitive data interest group, I think, is a given part to have some sort of collaboration with. And like I would love to be part of this in any way or form that you need.
That's great. So we did the sensitive data working group, and we have so Francis has provided some comments. We reached out to Alexander as well about this group. What can I say? So I think, you know, part of what so I was presenting this work at a recent so it's called AskMed, is a kind of European Infectious Disease Society conference, and I had a lot of interest from folks in AMR. So I don't. It's probably, you know, related to the representation at this conference. There's a lot of AMR folks. But I do think in a way, you know, it's useful to think about, can we just get some communities that are really interested because they want to understand, you know, how could we actually understand what work is going in terms of making these data visible. And AMR makes a lot of sense because we know about it. So it's not an emerging pathogen, but there is kind of this feature of emergence where we really need data sharing, and we need different types of data. So we can't just rely on clinical data. We can't just rely on research data. We really need, you know, we need the omics data. We need the lab data, the sample data. So that was a very interested and motivated community. And then when I look at cancer, you know, so really cancer and cardiology are where we've made a lot of advances in terms of implementation of FAIR. And both of those spaces are at the point of really working on digital twins, where if you look at infectious disease or specifically emerging infectious disease, we're very far away from that. So there was kind of some thought that went into thinking about, you know, if we work on cancer, we're at a place where where there's been a lot of investment in FAIR. They're much more advanced than AMR or anything in infectious disease. And so perhaps we could kind of hit those different sides of the spectrum in terms of folks who are more advanced in FAIR and more advanced in kind of working towards federated data reuse, and folks who are really not very advanced. So really struggling with connected data and any type of data reuse, let alone federated data reuse. But I do think so. One thing that I've noticed in Europe is just there has been kind of this split between the work that's done by EASC and then the work that's done on EHDS. So it could be that this new working group is going to try to bridge that gap, because for me it looked like there wasn't a lot of work to connect those different initiatives, which was obviously concerning. But I think it does make a lot of sense, and we've talked to Volmar. So Volmar, he was working with CJ on specifically kind of semantic and syntactic interoperability features of the GORC implementation model, and then he also leads a task force within EASC in terms of semantic interoperability. So we would definitely try to leverage kind of those contacts and have had conversations with those folks. And then I think, like, for folks who are newer to RDA like myself, it's not super clear to me what's the difference between a task force and a working group, or what these different options might mean. So maybe if you could give like a very short summary of what you see as kind of the pros and cons of this being a working group or a task force, or the Tiger mini or small project, that would be useful.
So I do want to mention that, Lars, you brought up a really good point actually around why it would make more sense for this to be a working group, at least to start out with, because as I said, task forces between groups aren't really established. And, this came up in a session last week, this idea of having a task force between groups. So it's not a formal RDA thing at all. And we don't have any, understanding of what that might look like or how deliverables might be quantified around it. Whereas if we have a working group, we do say, like, there's a charter and you got to have your deliverables in here and it has to be done within 18 months. You can get extension to 24 if you really need it. And it's like it's there. We know how that works. And that's an aspect I hadn't really considered. I was thinking more about like the collaboration with groups, and you mentioned the sensitive data interest group first right there, and then RDA groups. So yeah, that's definitely the top of our list. And we were very careful when we were requesting times that we didn't want to intersect with sensitive data, and we didn't want to interact with life science data infrastructure. Those were the two we really didn't want to have sessions on top of. But we were thinking, a task force between these groups and the GORC group would certainly fill, like the topical need. Like it would be topical, but I think you raised a really good point around there's no structure around what such a task force would look like, and because of that, it would be potentially dangerous. Like you might not have deliverables at all, or it could stretch out forever. Especially because these guys are interest groups. They don't have set end dates, or deliverables for that matter. So that's a really good point. But I might also highlight in terms of other RDA people that we want to include, I made this list, and I tried to order them based on importance, like not maybe importance, but relevance perhaps. And unfortunately, there's a lot of health data groups that were withdrawn. So all these three are withdrawn, but these top three, sensitive data, health data interest group, and raising fairness and health data and health research performing organizations, very, very topical, but in maintenance mode. And then to me, the next most important one would be life science data infrastructures. And then we've got a ton that have this medical science tag that we would also reach out to. A lot of them are from the COVID-19 era, of course, which is again topical. But no, so I appreciate that. Lars, that's a really good suggestion. And I really appreciate that idea around we need to be careful on how deliverables are set, because otherwise it could fall into obscurity.
Maybe I can very quickly highlight the Tiger small projects at this stage.
Yeah.
Yes, please.
So my name is Lisa Lehtela, and I work for RDA Europe on the Tiger project mainly. And on the one hand, Tiger is offering facilitation services to working groups, and the health data GORC has actually even applied for and received. So it's receiving support currently from RDA Tiger. But within Tiger, there's also the option of small projects that GJ mentioned. And those are discrete projects that would be funded through the Tiger project, and that aim towards their demonstrator projects, basically adoption or demonstrator projects. The thing to keep in mind with them is that we would have to make kind of like a public procurement for them, meaning that there's a description of work that you would like to see happening, and then we would make an open public procurement call, and then would receive 1, 2, 3, however many applications from people who would like to do that work. So it's really now, in my personal opinion, suited for very well-defined demonstration aims. So let's say you want somebody to come up with a specific deliverable around what would the governance of a health data cloud commons look like. So it's a very discrete demonstrator project that you would then farm out for somebody to do. So those are the small projects. So if they make sense, if you can define those very, very specific deliverables that I think here from the presentation, it's clear that there's some specific deliverables that you have defined where this actually could work. But then it wouldn't be the whole work that's been outlined in the case statement. It would be more specific.
Go ahead, Lars.
Yeah, especially based on the information that Lisa gave here, I think it makes very much sense to have it as the working group, and then once we're finished with the deliverables, the next outcome could be to apply for a small project as a way to adopt those deliverables in an actual health data space somewhere, to actually have them be adopted. I think that would be the way forward for this group to really produce something that hits home. And I think it's really needed. Like, I know today I got asked questions that relate to these things for collaborations between Norway and Sweden and Finland. So I know that this is really things that researchers ask for right now. So I think it's important to try and get this work up and running. As a side note, if we need to have the help of, for example, Volmar, I work next to him more or less, so I can easily talk to him. I talk to him every week, so I can easily work as a liaison there if we need to include him into this working group in some fashion. I know he's very busy, but
That's great. So I think like our chief interest with, so Wilmot was able to come for our last meeting last week, which is great. And I think our chief interest there is to really leverage the work that's going on in the life sciences infrastructure working group, where I think there's been a lot of kind of community building. There's a lot of folks who are interested, and then in this proposed working group, perhaps because it's newer, we haven't had as much let's say buy-in from the community, perhaps. But again, we're just getting started. And I do like, so when I started this working CoData a couple of years ago, actually, there was somebody who reached out, I think from I can't remember which country now, but basically there were folks that attended who were in the process of thinking about this, and they wanted to understand the implementation decisions of folks that were more advanced, like the Nordic countries. And we had to say, look, we don't have any metadata to describe what's happening in these different health data spaces. And so I think I agree with you, Lars, that there is a lot of interest, and the interest is right now. And certainly from the surveillance side, there are a lot of folks who'd like to understand, what types of data are being made available in these different health data commons, and how can they be accessed, what types of formats those data are in. So I think that there's quite a lot of interest. Yeah, so it sounds like there might be kind of more support here for a working group as opposed to a task force, if I'm understanding correctly.
That's definitely what it sounds like. And I think, yeah, without having, rules and regulations and definitions around what a task force might be, it definitely is a safer bet. And so, Lars, I'm really interested in the fact that you're already getting questions around, from researchers that are related to the work that we're proposing, and keeping in mind that a working group, it needs to be 18 months, and we haven't actually submitted our case statement for tab review or community review or anything like that, and that takes a couple of months. Lauren and I have like an idea of when that would happen, and that's on the next slide. But I think maybe something that might be helpful with the time we have is thinking about this draft work plan and approach. So even if we can get the group up and running soon, like let's say Lauren and I just really go for it and we have a case statement submitted in June, right? And it's open for comment. So the case statement's open for comment and review. And you saw me kind of flipping through it earlier, where we've got ideas of who to work with, but all this needs to be made more narrative. We've got a ton of content, too much content, frankly, in the value proposition, and too much content again in the charter statement. But all of this needs to actually be refined down and written. We have some stuff here, and that's all open for folks to comment and edit. Well, you can't edit it directly, but you can suggest edits. We do need to have some sort of version control, not just chaos. So this is all open for folks to look at and read and all that stuff. But let's say, for the sake of argument, we can get it in June. That means that it can start sometime in August, because it usually takes 2 months for tab review and community review, even if they go all according to plan with very little revisions or recommendations from RDA. That would kind of imply starting sometime in August. And so if we want 18 months from there, then we're not going to have like a full deliverable until a year and a half afterwards. So like maybe 2026, early 2026 is what that would look like. So if that's kind of what we're aiming for, but you're getting questions on it now, does this kind of draft work plan make sense? Or can we condense it down? Or can we, without cutting out feedback from the community? And that's kind of what I'm concerned about. I think one thing I see is like, we would start building the profile at 4 to 13 months. And when we've got new versions, we would just make them public and say like, not an official output, not an official deliverable, but this is what we've got so far. This is the information we've been able to gather and accumulate. That could be one way to help in the interim. But the draft work plan is also open for comment. So I don't know if maybe we have any more ideas, maybe specifically on how do we get that content or information out fast. But not too fast.
I think this is a great work plan for that space, that you start working with sort of draft outputs that you then can lock as you sort of progress. You can make release versions. I think that's a very helpful and healthy way, and then people can start trying them out, see what it works and what works with it quite quickly, and that will give us back probably quite a lot of good community response that we can adapt to. If we have a way of submitting back the issues or feature requests, so to speak, from the outputs, I think that's a good way of doing it.
Yeah, I think maybe even in addition to like submitting feedback, like asynchronously, there's also this, you know, in like the last 6-month-ish span of the working group, we want to have almost like community of practice meetings with Health Data Commons, and they don't have to be the same people that were in the speaker series. You definitely want the people from the speaker series to be in that room, but we were actually thinking it would kind of follow that snowball sampling idea that Lauren had mentioned, where we'd have an even wider group actually attend that and do the final revision on the profile. So that may also be a way to do it, is like we have feedback on each one, then maybe through some asynchronous questionnaire or survey or a ticket system, depending on what the container is, right? That's going to be what really determines that. But I think that also is a helpful way to say if folks are seeing, you know, version 0.3, and that's their first introduction to it. So maybe they're too late to be part of the speaker series, but they can come and be part of this community of practice thing in the last, like in month 13 to 15. And still have major input onto what that final version looks like. That's a possibility for sure. That is something that gives me anxiety as a researcher, though, like putting out unfinalized drafts and have people rip it apart before it's finalized. But I think it is the best way to do it within RDA, and I think it's the best way to do it, as you say, because the information's needed now. We don't want to wait until we have the version 1.
I guess, TJ, is there anything in the case statement that you feel like we could usefully discuss besides the timeline?
So the only other parts of the case statement that, I mean, the case statement has many parts, but we've got a charter and value proposition, which are all narrative, engagement with existing groups in the area, which we've kind of given a brief overview of, and that those can definitely be expanded if we think of more now. I have written a sustainability, like the UN Sustainable Development Goals section. That's not quite as relevant, I think, for the BoF at this point. And then the work plan, which we saw a summary of. There's also an adoption plan that was suggested, but that can also be edited. And I think, yes, I think it's at this point we need to kind of figure out who's going to be in the initial membership, and getting the case statement submitted is where we are more so. I don't know. I don't have any specific questions of maybe what to say. To me, the work plan is kind of the most important part of the case statement to me. And if that looks good to everyone right now, then that's great. I don't have anything else specific from like the value proposition or the charter, especially where they're all narrative. It can be a little bit hard to do in a synchronous format. But Lauren, if you have anything that you wanted to highlight, I can just tell me where to scroll.
I think, let's see. So maybe Lars, just a quick question for you. When folks kind of ask you for the Nordics, you know, like I'm assuming they're asking you for some kind of metadata to understand different levels of interoperability. Like, what can you just give us some examples of the questions that they're coming to you with?
Yeah, basically the one I was thinking about was question, without being too specific. There was a group that is basically asking where and how they can work with their data and where to sort of publish it to work together between these three countries within. And they ask kind of what platform should they be on and how should they do it, like what metadata do they need and so on. So that's the concrete question that I got just this Monday, like where do we publish in Sweden so that we can publish a data set so that they can do it within keeping within the laws and regulations of using these sensitive data that they have, of course, because it's health data, and then how can they what kind of data metadata is needed to provide that, and so that they can have a link between the three big collaborations there. That's typical question, and we get similar questions.
Yeah, okay, that's useful to know. So I think one of the challenges we talked about in the last meeting was who we can get in the room. So last time we had a couple of people call in from Health RI, which is great. And they asked us if we talked to the Health RI. So Health RI is a Health Data Commons that's being set up in Netherlands. And I think part of the challenge here is just to engage those different groups like Health RI, because they're kind of in a way our target audience. So we need them to provide their metadata. These metadata are oftentimes not visible, so it'd be hard for us to get the metadata without them providing us with the metadata. And then we'd like them to kind of define what metadata would be useful for them to think about implementation decisions, and have them engaged so we had that about kind of pursuing that as essentially setting up calls with these different health data commons, pitching them on the working group and trying to get their interest. And if they're not interested in somebody from their staff or themselves joining the working group, then at least perhaps recruiting them for the speaker series so we can get a sense of what decisions they're making, how they're making those decisions, and then have that kind of pave the way to engaging them later on and providing the metadata that we define for their health data commons, so that we can then work towards this living network graph of kind of the different types of interoperability across these health data commons. So that was the way that we were thinking about kind of going after these health data commons. But I'm wondering what folks think of in terms of that approach, and if they have kind of other ideas about how to engage health data commons. There are other initiatives that are already trying to do this work that we may not be aware of. So no problem if there's no suggestions.
Not spontaneously, like
yeah.
I have to think a little bit more. Maybe Villa has some ideas.
Great. And one thing that we have been working on is trying to think about co-chairs for this. So CJ and I had reached out to kind of different groups of colleagues in different geographies to see if folks would be interested in, if this is something of interest to them. And the sense that I've gotten is that folks are pretty overwhelmed with other work and are not able to commit time to this. So I think also like suggestions of people in your network who might be interested in working as a co-chair, it would be really welcome for us.
I mean, I would be really interested in working as a co-chair, so we can
great.
Definitely.
Okay.
Scroll all the way down here and just write Lars. Lars. Done.
Yeah, that works fine. Yeah.
And so I can give you editing access to this document afterwards, but I'll put a question mark here because I appreciate you said you didn't want to be spontaneous. So you can retract that if you want.
You know, it's something I really think it would be something I would enjoy, and I do have time to devote to the working group, so that would work fine for me.
Okay, great. Yeah, so I think, Lars, maybe just so that we have your updated, oh no, wait, you filled out your contact information in the collaborative notes, right?
Yes.
Okay, so then Lauren and I can follow up with you. But we do have like a call for co-chairs, and we're hoping to solidify who might be co-chairs by July 1st, or at least hear from everybody who might be interested by that point. So if there's no more discussion pieces, I guess, Lauren, will move on to our last slide, which is kind of what we're thinking comes next. So we're hoping to hear from co-chairs by July 1st, submit the case statement by August 1st. So like this timeline that I was talking about before is not all that far off from what we're already thinking. We are hoping to get things done over the summer, accounting for the fact that we probably not going to do it in June because folks are going to start taking vacations. We need to account for that. And then what we'd really like to see is our first meetings starting in September, with maybe that speaker series starting in something like October or November at the latest. No later than January of next year would be the idea for the start of the speaker series. The updates for this group, because it's affiliated with the GORC International Model Working Group and the GORC Interest Group, we're going to be sending updates in the interim through those groups, as well as emailing people directly that have signed up on the collaborative notes. But because this group isn't formally ratified within RDA, we're going to be using the GORC mailing lists as appropriate. I will also mention that the GORC International Model Working Group will likely go not in maintenance mode, but it'll be, I don't know, reborn from the ashes as the GORC International Implementation Working Group, or GORC 2. So that name might change in the semi-near future, sometime over the summer. But that's kind of what we're thinking. And Lars, we've got you written down in the case statement, so it's written in stone. But we'll follow up by email and just make sure that everyone's on the same page and with a good comfort level. Are there any other things that we'd like to bring up? Anything else, Lauren, that you think we should mention?
I think this is great. So, so the collaborative meeting notes will be open, and if there are folks that you think we should reach out to following this call, that we'd be really happy to get that information. And then if you could talk to your networks, if you think the work is important, you could talk to your networks about trying to engage other folks in this space and this work. That would also be great. And then I think like just in our own interaction with folks in cancer and AMR, it does seem like it might be useful to engage certain communities that are really motivated to think about federated data reuse. So, rare disease could be one of those communities. But I think the other side is we're really interested in the cross-domain space. So health is obviously, we have a lot of our own problems. I tend to think that other kind of data type, other data domains are doing a much better job. So climate data or oceans data, they seem to be much more coordinated than health. But we'd like to think about, as these kind of health data spaces evolve, how are they, co-evolving with the oceans health data space or biodiversity health data space. And so if there's so many kind of different health data spaces, if there's one that you think we could think about, climate there's obviously a lot of focus on climate and health right now, but the same with biodiversity or many other data spaces. So I think if we could also think about, okay, what is this another specific kind of sister data space that we could try to think about looking at those cross-domain kind of cross-domain metadata, that would also be of interest. So we can, that work, I guess, would be secondary to our work in health data, but something that we could also try to think about. How would we get that started at some point? But I'll say we really appreciate you taking the time to join this, and it's great to know that folks are interested and see this as valuable. So really great feedback, and all of your questions and suggestions have been really spot on. So thanks so much for your engagement here.
Yeah, just echoing that. So thank you again for attending the Birds of a Feather and all the suggestions, and especially voicing interest for co-chairship and membership, because that's what's really going to be driving the work forward, is the work of the co-chairs and the members in particular. But yeah, hopefully we'll have more updates for everyone later in the summer, and we'll be following up with some concrete actions just for the people that have attended the Birds of a Feather session. Not this one, but both of them afterwards, as per, plenary policy. But I think, yeah, we can end 10 minutes early, give people back that time in their day. And feel free to reach out to Lauren or I. Our emails are on the slides there. And yeah, just thanks for being here. We really appreciate it.
Thanks. Great initiative.
Yep. Thank you. Thank you, guys.
Thanks. And thanks to Lisa and CJ for the facilitation and support. That's great.
Thank you. I'll stop the recording now.
Okay.